Good morning, everyone, and happy Wednesday. We're going to go ahead and get started with our presentation today. Again, good morning. Welcome to today's Recovery Summit presentation. The Recovery Summit is brought to you by St. Clair County Community Mental Health in partnership with the St. Clair County Health Department. Today's presentation is the benefits of a specialty substance use disorder credential presented by Jennifer Mitchell. First, we are going to go over a couple of housekeeping items. I know those of you who have attended already have heard these, but we're going to review them again. So some general reminders. For any attendees, please use the chat feature at the bottom for any comments or questions for the presentation. And for Jennifer, if time allows, we'll go ahead and cover some of the questions at the end. If we're not able to get to the questions, Jennifer has shared an email, which I will put in the chat several times, that if there's questions at the end that you would like to specifically ask her or ask MCBAP, you'll be able to do through that question. Today's presentation offers one social work CE and one MCBAP credit. So please remain on the webinar for the entire time for today's presentation. If you find yourself for any reason losing connection, just go ahead and hop back on and we'll be able to note that. For those of you who are not familiar with webinars, we cannot see you. So we have some questions once in a while of folks, if the camera's on or if they can unmute themselves, we don't see you and we aren't able to hear from you. So again, please use that chat feature for any interactivity or questions. There will be a survey at the conclusion of the webinar that will pop up right at the end. We really appreciate everyone's feedback from each presentation. And just as a reminder for those of you that are requesting social work CEs, it's required that you complete a survey at the end. So again, the survey will be sent out at the end of the presentation. Now to go ahead and introduce our presenter, Jennifer Mitchell's with us today. She is the Executive Director of the Michigan Certification Board for Addiction Professionals, which we know also as MCBAP. She has over 25 years of professional experience in substance use disorder fields, also as a counselor, a clinical supervisor, operational leader, and an advocate as well. So I am going to head to spotlight Jennifer and put the floor over to her. Welcome, Jennifer. Thank you so much for being here today.
Good morning. Thank you so much for offering this session. I really appreciate it. So thank you also for that nice introduction. Like she said, my name is Jennifer Mitchell. I'm the Executive Director of MCBAP, and I've been with the organization for about 2 years now. But for my entire career, my passion has been substance use disorder treatment. And so that definitely has carried me through my career. I started out as a counselor in Kentucky. I reciprocated my own substance use certification to Ohio, where I received my master's degree in counseling. So I'm a licensed professional counselor. And I reciprocated once again, and finally to Michigan. And the reason that I mention reciprocity is that that's one of the benefits of having a credential with MCBAP, is that our credentials are reciprocal in many other states. 49 out of the 50 states have some version of a MCBAP credential, all branches of the military, as well as many other countries. That's why it's considered an international credential. And so a few things that I like to start out with is that we're super proud of our credentialed folks. For example, Larry Davis recently let us feature him on our social media platform. So if you know someone who is a proud holder of one of our credentials that you think we should feature on our social media platform, feel free to send us an email to the email address that they're popping into the chat, and we'd love to feature. We have over 4,500 credentialed professionals within the state of Michigan, and over 2,000 people are in the process of receiving their development plan. So that's 6,500 people that are proud of their credentials throughout the state of Michigan, and we are very proud to serve them. So some of the benefits of a specialty credential, I know sometimes people ask us, what is the benefit of having the substance use disorder credential, especially if I already have a full license? And as I shared, I also have a full LPC. And so some of the benefits you'll see here on the screen: specialized knowledge and expertise. So for all of our credentials, there is an education, and I'll get more into that in a little bit, but there's an education component to it that is specific to substance use disorder. And so when I received my LPC, my licensed professional counselor, I came out of graduate school fully understanding things like how to do cognitive behavioral therapy. I felt really competent to work with folks with depression, anxiety, the worried well, if you will. But what I didn't have necessarily was a focus on any specialty. And so this credential really helped me to set myself apart as someone who understood substance use disorder. And as we all know, if you work in substance use disorder, it's a very complex condition that affects medically the individual, as well as psychologically, socially, their employment, all aspects of life. And because the condition is so complicated, the American Society of Addiction Medicine has ASAM criteria that actually outlines which level of care folks are eligible for based on all of those signs and symptoms that they have going on. And it's the most complex level of care system that we have. And so just because someone is able to work in the mental health field as a general practitioner with their license, they may not understand medication-assisted treatment, detox, residential, partial hospitalization, intensive outpatient. There are a lot of things, harm reduction. There are a lot of things that go along with the substance use disorder field that make up professionals in this field. There's a lot to learn. And what you know, if you have one of our credentials, is that you have learned a ton in the process of getting that credential. And it has increased your credibility and differentiated you from others. So for me, if I have a loved one or I myself want specialty care, I am going to look to see what credentials that person has. So this is also in healthcare. If you, for example, have breast cancer, you want to go to a specialist who understands that. You don't want to go to your primary care physician. You want to go to someone who has a board certification in what your particular condition is. And so if I'm seeking care for a family member of mine, I'm going to look for someone who has a specialized substance use disorder certification, not someone who just has general knowledge and general training. And I think that probably you yourself also, if you have a family member who's struggling with substance use disorder, you want them to be treated by the most competent, the most ethical, the highest trained person that they possibly can. They deserve that. And so having this credential offers that credibility and differentiation. Expanded scope of practice. If you have an LMSW, an LPC, or you're a licensed psychologist, all of our codes of ethics say that we need to stay within our scope of practice. So we should never make claims that we can treat individuals that we don't have specialty training to treat. And so this credential provides validation that you, in fact, do have the ability to treat folks with a substance use disorder. And so it keeps you in line with your own professional code of ethics. Improve patient outcomes. So for all specialty, not just substance use disorder, but all specialty certifications, there is evidence to show that individuals who have additional training and expertise that they have gotten in the process of receiving their specialized credential have improved patient outcomes because they have that depth of knowledge. They can make the appropriate referrals and make the appropriate connections that improve patient outcomes. There's also enhanced career prospects. As Adrienne mentioned at the outset, I have experience being a clinical supervisor and a program administrator. And I've had individuals that have received their credential through the agency that I worked for, and they wanted to move on. Maybe they were choosing a different specialization. And I always encourage them, keep this specialized credential because it actually expands your ability to obtain the job that you want, even if it's not specifically within substance use disorder. Because as we all know, at least 10% of people will struggle with substance use at some point in their life. And it's probably more than that, but that's our conservative estimate. So even if you choose a different field, you're still always going to be working with people and their families who have substance use disorders. We also, it is a professional recognition that is recognized. People understand what our credentials mean, and you are more likely to have referrals to your practice if you have a specialized credential. It's also helpful in examples like this. We're all here today. It looks like 90 of you are here to talk about this specific certification. So there are times that we have interdisciplinary networking and collaborative opportunities based on these credentials. And the ability to contribute to the field once you have received this level of education is exponentially better. Because you really do have a depth of knowledge that you may not have had moving into this work. So when I have been a clinical supervisor, I always start out working with someone, letting them know that they may be entering into a development plan to receive a MCBAP credential. And people were always nervous and they wondered why they should have to do that. And then what I noticed over those couple of years as they worked toward their certification, this increase in pride and depth of knowledge and ability to speak with others who work in substance use disorder fluently in the language that we have. And we're so proud at the end when they were able to obtain that credential. And so those are all some of the benefits. I could go on and on about what the benefits are of this credential, but those are just some of the highlights. And for all of our credentials, MCBAP has, as you know, we have credentials in peer recovery, prevention, treatment and counseling, as well as clinical supervision. So we have a variety of credentials. For all of our credentials, there are certain key pieces that are required. I won't go into each individual credential. You can find on our MCBAP.com, if you click on credentials, you will see a PDF document that comes up and you can print that out and it goes through. I'm going to do the highlights of all of our credentials and what the requirements are. If you want the specifics for the credential that you're interested in, you'll want to print out that PDF and really go through that and see which one is right for you based on your experience and education and career goals. And then once you've done that, then it will really give you the detail of what you need to do to work toward this whichever particular credential is right for you. But for all credentials, there's a work experience requirement related to working in substance use disorder. You'll see a theme here, and the reason I call it a specialty credential is that when you're trying to decide, will this help further me in my goal of getting this credential? What you want to think of is this specific to substance use disorder? And so when you're thinking about your workplace, do you have the opportunity to work with folks who struggle with substance misuse or actually have a diagnosis of substance use disorder? That may not be 100% of your clientele, but it should be a percentage, a pretty hefty percentage, so you get that experience in this field. For each of our credentials too, we have what we call domains. And so what you'll be asked to do is submit your job description from your current position and any other work experience that you've had previously that you believe might count toward your certification. And in that job description, what we're looking for is to see, were you getting experience in the key pieces of that job that relate to this certification? So we want to see your actual official job description so we can review that just to make sure that you have had the experience that will help you in moving toward your credential. It can be as paid or as volunteer. So some folks want to show that they're working toward this certification in order to obtain a position. So many people will start out doing volunteer work at treatment centers or in prevention networks, that kind of thing. And that will count. Again, we would just need a copy of that job description. However, anything that you're doing toward your own personal recovery, such as 12-step meetings and that kind of thing, that doesn't count. This really has to be in the service of others. And all of this work experience should have occurred within the last 10 years so that you have the most up-to-date information about our field. And so depending on which credential you're working toward, you may need to have a degree. So for example, for a certified advanced alcohol and drug dependence certification, what you would need to have is a master's degree in a related field, in a clinical field. For other credentials like a peer, you may only need to have a GED or a high school diploma, but in either case, what you need to have is we need to have the degree sent to us directly to MCBAP from that highest level of education that you receive. So it needs to be an official transcript in the case of a university, or it needs to come directly from the school if it's in the case of a GED or a high school diploma. We don't accept copies because part of what we have to prove and part of what we need to go through is making sure that we have really vetted our candidates successfully and made sure that they have all of the background that they're claiming to have. So we do have to have that come directly from the institution. And so when we think about education for our credentials, there are two different things. One is your degree, what degree you have obtained, and the other is your ongoing education that you will receive in the process of getting your certification. And so your education for ongoing education after your degree, we want it to have occurred in the last 10 years. As you'll see, we want your education, your work experience to be fresh so that you have the most up-to-date and current evidence-based practices. And so we want it to have occurred within the last 10 years. We also want to have a verification of that education. And what we need is a certificate. So I heard her say that she will get certificates to you after this. And on those certificates, what we're looking for is your specific name, the agency that's sponsoring the event, when it occurred, what the title was, and the number of contact hours that were awarded. And so for many trainings that you go through, they may say on the certificate MCBAP approved. In that case, the agency has gone ahead and gotten approval from us in advance, and those are the best trainings to attend. However, even if they weren't specifically MCBAP approved, let's say you got it through the NASW, we'll still review that certificate that you give to us and verify where it came from and determine whether it's specific or related. But in those cases, we may ask for additional information from you, such as a PowerPoint presentation, the objectives that you covered, any of that kind of information. So you can still submit those, but we may ask for additional, we may have additional questions related to that. So I mentioned specific and related. These are the two this is the most common question we get here at MCBAP. I guarantee Carrie is answering the phone right now. Someone's probably asking if a training is specific or related. And when you're thinking about and trying to figure out if a training is specific or related, here's some tips to help you. So the first thing is what I said earlier. Does it help you specifically to work with folks with substance use disorder? And the ways you might know that is if the title, goals, or objectives specifically say the words alcohol, tobacco, or substance use. They also may say substance abuse, substance use disorder, drug addiction, chemical dependency, etc. Another key word is co-occurring. However, for co-occurring, it needs to be co-occurring with substance use disorder. So for example, a class called Eating Disorders in the Treatment of Substance Use Disorders would be specific. However, treating a co-occurring eating disorder and anxiety would not be specific because, again, it doesn't specifically indicate how that training is going to help you best understand substance use disorder. So that kind of helps you give a framework when you're deciding, should I take this class or shouldn't I take this class? Is it going to help me further my education toward my credential? So check to see which certification you're working toward and whether or not it requires specific or related. I will tell you almost all 100% of our credentials require a certain amount of specific training. So if you can't decide, you're trying to decide between two trainings, if one of them is entitled specific and the other one is related, we would encourage you to choose the one that is specific. Related courses, sometimes people are like, but it's still a good class, and we don't disagree. There are lots of amazing trainings out there that are good and will help you advance in your career. However, they might not necessarily assist you in becoming a specialist in this field. And so there are some things that don't directly address SUD issues, such as gambling, your general counseling skills, specific trainings like EMDR, trauma-informed care, clinical theory. Those are all things that are important for us to understand when we work in this field, but that would be true regardless of the population that we worked with. So those are what we consider related. There are also some classes that unfortunately we don't accept at all, that may be required by your agency, such as food safety. If you work in residential treatment, you're probably required to take a food safety class. You may be required to take classes related to fire safety, that kind of thing. Those do not, those won't count toward your specific credential, but they're definitely important for your workplace. Another requirement for all credentials is testing. And this is the part where people get the most anxious. No one hears the word testing, gets excited. Well, maybe you do, but I haven't met that person yet who gets excited about taking an exam. But one of the things that we want you to know is that when you have the certification, as I mentioned earlier, it's reciprocal. And so what that means is that you can take this credential and work in different areas in different states and even different countries. So what this test is asking you to demonstrate is fundamental knowledge that would be helpful to you regardless of where you work. So this test is not about your specific agency. This test is about your general knowledge of the certification credential that you're working toward. So if your agency has encouraged you to obtain a development plan, what we encourage you to do is to choose materials that are recommended by MCBAP and by ICNRC. ICNRC is the International Certificate. I'm sorry, they're mowing, of course, outside right now, just as I'm doing this training. So I apologize if you can hear that. But it's the International Certification and Reciprocity Consortium is what ICNRC stands for. And they're the ones that actually administer and develop the exam. And they do that in partnership with all of us who have this certification. And so all of those test questions that are developed are actually developed with those of us who have the credential and with testers or folks who are expert in developing tests. Those two work together, subject matter experts and Prometric, who actually administers the exam, work together to develop those test questions. So sometimes people say, I can't pass the MCBAP exam, and it's actually not a Michigan only exam. It is an international exam. And so I always say that this is the education portion. This is like the book learning portion of the program, and it really does require study. And so we encourage you to focus on materials that are recommended by MCBAP and ICNRC. And we encourage you, if your agency has had you sign up for a development plan, as soon as you sign up for your development plan, get those resources together, take a practice exam, and see where you need to focus your study. And then continue to study and take that exam within 9 months to 1 year of entering your development plan. I started here about 2 years ago, and at that time, what I noticed is that there was a rumor out there that you could not take your exam until you were almost finished with your development plan. And not only is that not true, it's definitely not recommended, because there's a mandatory 90-day wait if you aren't successful at passing the exam. And so if your agency has given you 3 years to complete your development plan and you wait 2 years and 9 months to take that exam, you're now in job jeopardy if you don't pass, because there are no extensions provided for failing the exam. And so what I was noticing is that people were extremely anxious when they waited until the end, and their chances of passing were less. And so we have been for the last 2 years really encouraging people to take that test as soon as you feel ready. And usually that's, if you've been studying, usually that's within the first 9 months to 1 year of entering the development plan. And that way you don't even have, you can just take a day off, be relaxed about it, take the exam. And if you don't pass the exam, they give you a printout and it says how you did in each of the domains. So you can refocus, decide what your study materials are going to be, focus on that during those 90 days and retake the exam. And what we've noticed when people have that strategy, they're much more likely to pass. The other best practice that we've learned from individuals who are successful at passing the exam is that they were part of a study group. And so if you have others in your agency who are working toward certification with MCBAP, form a study group and then break down the materials that you want to read. You read them, it's like a book club. You read them and then you come together and you talk about those resources. And the reason this is helpful is one, it holds you accountable, right? You don't want to be the one who didn't do their reading. And two, human beings are wired for stories. And so if we read a chapter on treatment planning and we got together and you described to me how you developed your treatment plan based on best practices, if I work in your agency, I know that client that you're talking about. Now I've heard from you about how you develop that treatment plan. That's stickier in my brain than if I just read a chapter on treatment planning. So it really is important to have study groups where you're talking to other people about the material that you're reading. If you don't have other people in your agency who are working toward the credential, we encourage you to reach out to your partners. So you're always referring to other agencies, they're referring to you. So ask them, is anybody in your agency working on this? And if so, can we do a Zoom study group? And lots of agencies have had an informal agreement with other agencies to do a study group together. And we've heard really great things about that. The last suggestion that I would give you right now is to consider extra assistance. And so those of us who work in healthcare, work in counseling, prevention, and peer recovery, I don't know what it is about us, but sometimes we're hard-headed and we don't ask for help. And it really is, the most common example that we have is someone who has an attention deficit disorder and they have real pressure about that time frame. You know, most exams have 3 hours to take the exam, and they may have trouble sitting still for that length of time. So they may need additional time and they may need more breaks. This is just one example of a special accommodation. So what we would need is 60 days prior to when you want to take the exam, we want you to complete the form with your doctor that we have on our website, and your doctor will say what special accommodations you need. You send that to us 60 days prior so that we are able to ensure that those accommodations are made available for you. Another requirement for all credentials is supervision. And so we want to learn from folks who've been in the field longer than us. And what we define supervision as, this may or may not be your direct supervisor, by the way. So sometimes people get a little confused by this. Your supervisor for the purposes of MCBAP is someone who's focusing and helping you work toward your credential. And so that is a formal, systematic process that focuses on developing these particular skills and integrating this specific set of knowledge. And so we want it to occur as part of your work experience. You may have more than one supervisor. So it could be that there's more than one person who works for your agency, or it could be that you have multiple part-time jobs and you may use more than one supervisor for this purpose. That's fine. We strongly encourage you to secure proof of supervision. We learned this the hard way. So we found some individuals who their supervisor had passed away and they didn't have any documentation of the supervision they had received under them. It could be that the supervisor was dismissed or terminated from the place of employment and they weren't able to contact them again. Or it could be that the person just retired and moved and they weren't able to get in contact with them again. And so that really put the candidate in a challenging situation in trying to get their certification, because we require someone sign off on those hours of supervision. And so if the person who has been providing the supervision is not able to provide that in certimy for all of the reasons I just mentioned, but you have documentation that you and your supervisor have been keeping all along the way that you've both signed off on, then you're able to present that to MCBAP as proof of your supervision. And so we encourage you and your supervisee to keep track of that in a place that's equally available to both of you. And then we want that supervision to take place in the ICNRC domains. And that can be found in the ICNRC candidate guide. And if I have just said something that you're not familiar with, and there could be quite a few people who aren't familiar with the ICNRC candidate guide, that is the perfect thing to email info@mcbap.com. Tell us what certification you're working toward and ask us to send you a link to the ICNRC candidate guide. And we'll be happy to do that, because that is something that we want you to have in hand as soon as you start working toward your certification. Here's where you find it if you want to find it on your own. You can go to internationalcredentialing.org and you'll have these PowerPoint slides. They're going to send them out to you afterwards or post them for you. You could go and find them on your own if you'd like to, or like I said, feel free to just shoot us an email. We're happy to answer that question. We definitely want you to have it available to you. I also always like to tell people the exam results, because sometimes if people aren't able to pass that exam the first time, they feel shame about that. And what I want you to know is that this exam, like I said, does require studying. It is not something that you'd necessarily be able to pass just from your work experience and your training. And if you look in 2022, for the certified clinical supervisor, 88% of folks pass their exam. That's fantastic. But the reason that 88% of those CCSs pass their exam is they already had familiarity with what it was like to take an exam, and they knew that they had to study for it. So you can see that the highest rate of exam pass are from people who have already taken another exam that's similar. So for the other exams, you'll see how many people. So in 2022, we had how many people? We had almost 500 people. We had 498 people who took the exam in 2022, and 70% overall of those folks passed. I will tell you that about once a month, the next one will be in October. I do, if you go to MCBAP.com and go to the training calendar, you'll see that there's an ICNRC test prep session. And that's something that I do, and I go through each of the exams and explain to you what to expect in terms of the number of questions, how the test was developed, what areas, which domain is heaviest weighted on the exam in the test that you're planning on taking. And so if you're interested in that, again, it happens about once a month. The next one is in October. You would go to MCBAP.com and go to our training calendar, and in the search feature, type in the word test, and then it will show you the sessions that we have planned for October, November, and December. You only need to come to one. I repeat the same information at each of those sessions, but folks have found it really helpful in terms of preparing themselves for the exam. So if you're brand new in your development plan, I encourage you to attend. If you're a clinical supervisor and you're helping your clinical supervisees learn more about what to expect, I encourage you to attend, even though you've already passed your own test. And if you're someone who is soon to take the exam and you haven't gone through that session, we encourage you to go through that as well. It's a webinar similar to this one. I schedule it for an hour, but it usually takes a half hour to 45 minutes, and I do it at lunchtime at noon on a Monday. So that tends to work with most people's schedule, and I do a deeper dive into these exam results and what to expect. As I mentioned, there's a 90-day wait in order to retake the exam, so you will want to take that early. Another requirement for our credentials is residency. So you must work or live in Michigan at least 51% of the time at the time that you make your initial application. Now, if you already have one of our credentials and you move to Ohio or Wisconsin, you're nearby, and you still want to practice in this area, once you have your credential, we don't do ongoing residency verification, but we do that residency verification when you first obtain your credential. One of the most important reasons that certification exists is public protection. And so part of public protection is to make sure that individuals who have a certification have an understanding of ethics, and that if there is a failure in ethics, that there is a process by which that they can be held accountable. And so for applying for the credential, you must read, sign, and adhere to the code of ethics. And we can't emphasize this enough. And if you feel as if there's someone in the that's working in our field who holds one of our credentials who's not abiding by high ethical standards, there is a process by which that can be reported to MCBAP on our website. If you go to MCBAP.com and click on ethics, you'll see all of the codes of ethics for each of our credentials, and you'll also see a way that those ethical violations can be reported. And when those are reported, they're actually investigated by an external investigator to ensure that there's no bias in the investigation. And it is that investigation is reviewed by the MCBAP Ethics Committee, and then it's dispositioned. And if a person is found reasonably to have violated ethics, there could be suspensions, sanctions, or even revocations of credentials based on that information. And also on the MCBAP.com website, on the ethics page, you'll see a list of folks. So if you're hiring for any position that requires a MCBAP credential, you should look at that page and see if your applicant has ever had any disciplinary action against their credential based on ethics. So that is important information for you to know, either when you're seeking one of our credentials or if you're looking to hire. As a side note, also on our website, there is a job board. So if you're also looking to hire folks within your agency, MCBAP has a job board, and we have hundreds of individual visitors to our website every day. And many of them, just think if you're looking to move into the state and you're looking for a job and you want to work in substance use disorder, ours is one of the first pages that people come to. And so if you're looking to hire, we would encourage you to post a job on our website. And that's something that we developed simply because we were asked to by so many providers within the state of Michigan. We actually charge a nominal fee for that, and that fee just pays for the ongoing maintenance of that function on our website. So for all of our credentials, there is a requirement that you complete an application in what's called CertiMe. And CertiMe is a portal where you're uploading all of your information in there. So you're providing proof of all of the things we just talked about: your education, your ongoing your education degree, your ongoing education, your supervision, your work experience, your residency, your attestation that you will abide by ethics, and your residency. You're putting all of that into CertiMe. One question we get a lot is that I've been putting a lot of things into CertiMe, but no one has reviewed it yet. And so the important thing to know is that your application, we have, as you can imagine, we have 6,500 people already with a credential or a development plan and hundreds of others who are in the process of making application. We don't review those until they're 100% complete. And the way that you can tell in Certimi if it's 100% complete is if you look in each of the sections, there's a little circle bubble, and it will turn green once you've uploaded and submitted the appropriate amount of information. So once 100% of that is complete, that then gets kicked over to us, and I assign it to a certification specialist. And that certification specialist for an initial application has up to 42 business days to review that application. So you want to make sure that you submit that as early as possible if you are expected to have one of our credentials by a certain time frame per your job. You want to submit that in advance. I'll be candid with you, it doesn't usually take us 42 business days. The times that it takes us that long is as part of the review, the certification specialist will have questions, and they'll ask you questions within Certimi. And so they may reject something within your application. And sometimes people get really worried when they see that something has been rejected. But what we encourage you to do is to look carefully at what that rejection is. Often it's that you may have just uploaded it into the wrong section. You may have accidentally uploaded the same certificate twice. And so we're just saying it doesn't count because we've counted it twice. There are a variety of reasons. So when your certification specialist is reviewing your application and you get rejections, I know it's nerve-wracking, but I would encourage you not to be so nervous about it and just be careful to read what the reason was for the rejection and what they're asking for as a replacement or an update for that. And then you have 45 days to respond to that. But of course, we want you to do that as quickly as possible. So if it's that you accidentally uploaded the wrong certificate and you just need to re-upload the correct one, we encourage you to make those corrections as soon as possible. What we notice sometimes, though, is that people never respond, not very often, but occasionally people just don't respond. And so we'll reach out multiple times to see if you're still interested in obtaining your certification. But as that application ages, it may end up being discarded just because it then becomes too old. And the reason I say that is, let's say you submitted education to us that was 9.5 years old and you wait 6 months. Now it has exceeded that 10-year mark that we talked about earlier. And so that may no longer count toward your credential. And so again, those are the reasons that we have those timelines. Now, one thing that I didn't talk about is development plans. And I know many of you may be in development plans or have questions about a development plan. And the development plans are between you and your employer. And if your employer requires a development plan, then obviously you'll need to have one. But if your employer does not require a development plan and your agency doesn't, you don't have to enter a development plan in order to get your full credential. The development plan is kind of like, I think of it like a promissory note. You're basically saying to your agency, yes, I promise that I'm going to work toward meeting all of the requirements of the MCBAP credential, and I will obtain that within blank number of years that you have come up with between you and your employer. But let's say you're in private practice and you want to obtain your CAADC, but your employer doesn't require it because you're your employer, but you want to work toward that. You don't have to enter into a development plan. You can work toward the development. You can work toward meeting the requirements for the credential without having that. And that being said, if your agency, your PIHP, if you're under the supervision of LARA, or your agency is the Licensing and Regulatory Affairs, and they require that you have a development plan, then that is what the development plan exists for. And that's why MCBAP created that in collaboration with MDHHS and LARA. But again, if your agency doesn't require it, you can just go ahead and make application. I'll also say, your agency will require either a development plan or a full credential. So let's say you've already met all of the criteria to obtain your credential, go ahead and make your full application for that rather than getting into a development plan. So those are things to talk to your employer about and see what's right for you. I also want to say, I know I just covered a tremendous amount of information in about 45 minutes, and you probably have more questions. And so we here at MCBAP like to do these types of trainings also at individual agencies. So let's say your agency has a group of people who are working toward their certification, and you want us to do a Zoom session and talk to you in more detail about what I just went through. Let's say there's a group of you who are just confused by Certimi and you just don't understand that thing at all, and you want to have us do like 15-minute Zoom session with you. We're happy to do that as well. And again, you would submit that request to info@mcbap.com and let us know that. I also, in terms of Certimi, would encourage you to make sure you have your personal email address instead of your work email address as your contact information. And the reason for that is, of course, you want to stay in your agency as long as possible. I'm sure that you love and are passionate about the work you do, but let's say later on, you want to make a career move. You don't want to lose touch. That's our primary way of contacting you now. We don't use the postal service. Sometimes people say, why don't you send reminders in the mail anymore? And that's because most people are really responsive via email now instead of the paper mail. So that's our primary way of communicating with you. So we do encourage you to use your personal email address rather than your work email address in Certimi, with the exception of if you are a CCS, a Certified Clinical Supervisor. For your supervision account, it's perfectly fine to use your work email address because employees are the ones that will be sending you requests to sign off on their supervision. So it makes more sense for them to send that to you through your work email address. Also, we rarely but occasionally send updates to your email address from MCBAP, and I do not like junk mail in my inbox. I know you don't either. So I definitely do not send a lot of emails from MCBAP, but when I do, those are ones that are targeted specifically for you. So if it's something only for prevention specialists, I only send it to those who have a prevention specialist certification or development plan. I don't send it to everyone. And so when you get an email from MCBAP, it really is directed to you. So we encourage you to open that up and read it. And we are just want to let you know that we're here. We are so grateful for the hard work you're doing out in the field. We appreciate everything you do. There is not a more honorable profession than what you're doing, and we just value and respect everything that you do. And so we want to say thank you. And this is Bo, this handsome dog is Stephanie Durbin, one of our certification specialists. This is her handsome dog, Bo. And so on behalf of everyone here at MCBAP, we just want to say thank you for all of the work that you do.
Thank you so much, Jennifer. I'm going through the questions right now, and the wonderful thing is a lot of the questions that were entered in chat, a lot of the other attendees were able to guide folks in the right direction and give some information. So a lot of the questions were actually answered. So I'm just going to backpedal a little bit. Some of them I think you answered as well too. One of the questions is if you had talked about it, or if you can review again, where do we go to sign up for the test itself?
So where you go to sign up for the test itself is go to mcbap.com, and there is a section in there on the test. And so there's actually a PDF that you'll be able to print out and fill out and then submit that to us. And if you're not able to find it, there are two ways that we can help. One is you can old-fashioned call us, 517-347-0891. Or when we're here during the business day, when you're on our MCBAP website, there's a little thing that will pop up in the bottom right hand corner, and it says something like we're here to help, I think it says. And when you see that pop up, that literally is one of us. So that's not a bot. You know, if you go to AT&T or whatever and you see one of those, can we help, you ask a question and it's a automated response. That's not true with us. So if you're not able to find where to sign up for the test or find anything on our website, pop in there and just tell us what you're looking to find, and one of us here in the office will help you find that. So those are the two ways if you're not able to locate it on our website.
Fantastic. A lot of questions back and forth about where to get the best study materials, and peers were helping peers with those. One of the questions, I think you answered most of it, but there is about multiple supervisors. When submitting supervision hours, what's expected to be submitted? Do we need specific supervision logs or just inputting hours spent with each supervisor? What if you have multiple supervisors?
And so that's a great question. So at the end, when you're ready to make full application, what you'll do is you'll send through Certimi an invitation to your supervisor. So for example, if I was your supervisor, you would send me through Certimi, you would pop in my email address and it would come to me. And then what it asks me as your supervisor to do in Certimi is to simply say the total number of supervision hours you and I did together. And it says how many hours we spent in each of the domains. So it's pretty simple. So if you need 100 hours of supervision, you have 4 domains. Maybe we spent at least 25 hours, probably more in each of those. I put that in and then I submit it. And so what actually happens on the end is pretty simple. However, again, you want to track that with your supervisor and your supervisee. In the event that either of you lose track of each other, you have a running log of how many hours you spent in each domain so that you can submit that to us. You can do that for multiple supervisors. So at the end of your time, you send that invitation in Certimi to more than one supervisor, and they'll be able to fill that out for you and attest to the number of supervision hours that you have.
Great. Again, I think you answered this one about the testing. Someone said, you know, they've signed up for the development plan, when they expect to have their masters, and can I test now or do I have to take the test again later? And I think you really cleared that up with kind of saying, don't. That's the important part.
I do have a caveat to that one. That's an outstanding question. Okay, so if you're in your master's program, but you have filled out a CADC development plan, I encourage you strongly to go ahead and take the advanced counseling exam. So take the CAADC exam rather than the CADC, because you're about to get your master's degree and ultimately you want the CAADC. So take that exam instead of the CADC. If you have, that's more nuanced. Sometimes people, if they're in the process of getting their master's degree, they go ahead and get their CADC. But make sure you take the advanced exam, because once you have that master's degree in hand and you want to upgrade that from a CADC to a CAADC, all we'll require is a copy of your test results as well as your official transcripts of your master's degree, and we'll upgrade that to a CAADC. Sometimes what happens though is people don't realize that and they take the ADC exam, and then when they want the AADC, they have to take yet another exam. So we don't want you to have to go through that. Just start out by taking the AADC. And again, that's more in the weeds. And so if you have questions about your particular situation, don't hesitate to reach out to us.
Great. Someone had mentioned the fact how great that clarification is, because they run into that a lot. So that is super helpful. Again, to review, when you're looking at if something is counted as specific, someone had just asked, so as long as it has something like cocaine or marijuana in the title, it would then count as a specific.
That's generally true. Yeah, there shouldn't be any reason that it wouldn't be counted. Again, we want to make sure that we have all of those elements on the certificate, saying who provided the training, how many CE hours and that kind of thing it is. We want to verify that that was legitimate training. And we don't accept transcripts other than from your university. So for those of you who have Relias, for example, what we don't want to see is an upload of your Relias transcript. We want each of the individual certificates from Relias, because we're looking to see the title, the number of hours that you took in the training and that type of thing. So sometimes people get confused by that too. So that's helpful to know if you have Relias at your agency.
Mm-hmm. Great. I know for this agency, when we talk about credits, that we were very fortunate this year and years past for the Recovery Summit to put an application in with MCBAP to be able to have all of these pre-approved for MCBAP credits, which is a beautiful thing. And the fact that it is also, if it's pre-approved, it's also put on the MCBAP website is sort of like help for marketing. Could you speak a little bit about that for different agencies or different folks that are doing maybe trainings, what the process is for that?
Absolutely. Thank you for bringing that up. So if your agents, there's two paths if your agency wants to provide training. So let's say, for example, you're just doing an internal training. I did this all the time at my agencies. I would do an in-service. So when I was doing an in-service, I would keep a copy. I would have a sign-in sheet. I would keep a copy of the PowerPoint presentation that was given out or any handouts that went along with that. And I would provide everyone with a certificate. And I would keep copies of those as well. And so if you're doing an in-service on your own, that's a way that you can just track and document that. If MCBAP ever questions anything related to that certificate, you have all of that background material that you're able to provide to us. So that's for an in-service. But let's say you want to open it up and you want to have more people come in and you want to be positive that this training is approved by MCBAP. If you go, again, I keep saying the MCBAP website like I'm on repeat, I swear. But if you go to the MCBAP website, it says on their training, and there's a section that says want to provide a training, ? And on there, there's a form that you can fill out. And you actually submit all of those materials to us in advance. And then I will get, or Stephanie in our office will get back to you and say, yes, this is approved toward specific or related. We actually give you that designation. And then you can market this training as MCBAP approved for how many hours, whether it's specific or related. And then we also will upload it on our website and you'll get more attendees because, again, we have hundreds of visitors that come to our website every day looking for jobs, looking for trainings, looking to have questions answered related to this credential.
Fantastic. All right. So I am going to go ahead and hop back on. Thank you so much, Jennifer. What a wealth of information on everything. I think you did a fantastic job covering everything. And I'm sure a lot of folks, especially myself, appreciate the fact that you're open and willing to do this presentation as many times to as many groups or even do abbreviated presentations so this information gets out to folks because it's so important to be able to understand and navigate. So we thank you for that. And we thank you for your time today.
Thank you so much for the opportunity. I really appreciate it.
Wonderful. Okay, so that is concluding. I know we had a couple of other questions. I would encourage anyone that has questions again to email info@mcbap.com so that Jennifer or her crew over there can answer those questions for you. Again, it's info@mcbap, MCBAP.com. And it also sounds like visiting that website is a wealth of information for individuals as well. So as a reminder, we're concluding for today, and the Recovery Summit continues to go on all month long, all through September. We have 22 presentations in total with different topics. Tomorrow's presentation, if you haven't registered or you have registered, will be at 1 p.m. and it's presented by Shannon McKeever on addiction, trauma, and EMDR. So to see events and to register for any additional sessions, please visit scccmh.org under the events tab and the Recovery Summit. And again, Jennifer has offered to share her slides for this presentation. So if you go to the same place on scccmh.org under the events tab and back to the Recovery Summit, in about 2 to 4 days, we'll be able to upload those slides on there so you have that information to refer to if you need to. And as a reminder, individuals requesting any kind of preventional credits, please allow at least 2 to 3 weeks after the summit has been concluded, and you will get one printout emailed to you with all of the information on which webinars you attended, which ones were social work approved, MCBAP approved, and you'll have all of that on one sheet at your fingertips, which should be nice and convenient for everyone. Again, please fill out the survey at the end of the presentation. We appreciate it here at SCCCMH and St. Clair County Community Mental Health, and I'm sure Jennifer would appreciate any kind of feedback we get as well too. Thank you all who attended this morning. We greatly appreciate it. And everyone have a wonderful day and a wonderful rest of your week.